Hi, I'm Nandi. I'm a licensed midwife, a trained doula, and a mother of 3. Welcome to my channel. Since I'm based in Sweden, in this video I'm going to talk about birth in Sweden. Most births in Sweden occur in hospital, as there are no birth clinics in Sweden. There are home births, but there are few and far between, I would say, because in most places the government does not pay for home birth. So it's up to the individuals themselves to pay the home birth midwife to attend their birth. Whereas hospital births in Sweden are paid for by the government or by taxpayers, so you don't have to pay any extra if you give birth in a hospital. Some exceptions to this apply. It's if you are not a resident or a Swedish citizen, then you might have to pay for giving birth in a hospital. In Sweden, the births in hospital, midwives are responsible for the care, or the primary caregivers in a hospital setting. If any complications should arise during birth, a doctor will be included. But if you have a healthy pregnancy and healthy birth, then your birth will be attended by a midwife and an assistant nurse working in the hospital. If complications arise during your care in hospital, a doctor will be included in your care. But in general, if you don't have any complications, a doctor will not be included in your care. So it's the midwife's responsibility. The size of the delivery wards vary all across Sweden. There are delivery wards in smaller hospitals as well as larger university hospitals. So depending on where you are in Sweden, you'll just have to find out where is the closest delivery ward to you. Regardless if you give birth in a small hospital or a larger hospital, you will be able to receive medical and non-medical pain relief. I'm recording this video in summer of 2022, and the newest numbers I could find of statistics were for 2020. And currently, when I'm filming this video, Sweden has a little over 10 million inhabitants, just to give you a perspective of the numbers that I'm about to read to you. According to Socialstyrelsen, approximately 112,900 births took place in Sweden in 2020, which totaled approximately 114,500 children, as 1.4% of all births are multiples. A total of 17.9% of all births in Sweden are via C-section, and 42% of all births were induced. So these are the numbers for 2022. So the rate of induction doubled from 2019, as more hospitals recommended induction from week 41. So previously, before they changed these recommendations, they would recommend induction from week 42. The average age of having your first child in Sweden was 29 years old. And subsequent pregnancies, the average age was 32 years old. The maternal death rate in Sweden is low, this due to that we have access to free maternity care during pregnancy and free hospital care as well. The maternal death rate in Sweden is 4 out of 100,000 births. If you're in Sweden and are pregnant and are not sure if you are entitled to free healthcare, you can go to 1177 Vårdguiden. I will link it below, and find out if you are entitled of free care in Sweden. In Sweden, all healthcare is optional by law. That means that you can say yes to part of care and no to some of it. So without, by law, without receiving lesser care. So regardless of saying you want some of the care but not all of it, that's your choice by law. You're also entitled to have an interpreter when you're receiving care in Sweden. Most of the time this will be an interpreter over the phone, and sometimes it will be an interpreter that is actually in place. The care after the baby is born varies depending on where you give birth. In some places you can be discharged from the hospital 6 to 8 hours after birth if everything has been without complications. Most, I would say all hospitals that have a delivery ward will have a maternity ward where you can stay for a couple of days, whatever is needed specifically for you to receive care. Usually there you will be cared for by midwives and assistant nurses and sometimes nurses. Some hospitals will have space for the partner to stay, and some hospitals will not have space for the partner to stay. So you will have to find out what is available in your area. In some places you will also be able to go home and receive care by a midwife and an assistant nurse, or maybe just a midwife, depending on where you are, at home for the first week or so, and then maybe come to the hospital again for another checkup, or depending on what is available in your area. If you choose to have a home birth, you will have to choose the midwife yourself. So you'll have to contact a midwife and pay for the midwife yourself. If you need, so when you have a home birth, you cannot have any medical pain relief. So if you need medical pain relief or surgery, you'll have to be transferred to the hospital. Most midwives that have home births are very knowledgeable and have worked for a long time, but they're not available all across Sweden. So you'll just have to find out if there are any home birth midwives in your area. You can find home birth midwives on a website called Föda Hemma, which I will link in the description box. And then you can see who, if there is anybody available in your area. So that was a little short summary of birth in Sweden. What did I miss? Is there anything you would like to have known more about that I should have included in this video? Please leave a comment below and let me know. Thank you for watching this video. Don't forget to subscribe, and I'll see you next time. Hejdå!